Hi guys, welcome back to another week. How are we all doing? Oh, Sarah's here. Hi, Sarah.
Hello, Luke. Hello, everyone. I met some of you in the lecture just before.
Oh, good.
It's Associate Professor Sarah Lal. Yes, Luke, I'll join you with the tutorial and pipe in occasionally with some of the question and answers. Yes.
That's great. Yeah, so guys, Sarah is your subject coordinator, just in case you didn't get a chance to introduce herself in the lecture. So she's been helping run things from behind the scenes a lot. Oh, there you are.
Here I am, everyone.
And she's also my supervisor. So she's been my supervisor for the past 4 years now, I think, Sarah, going on 5 maybe. It's been a long time.
Yes, and Luke is finishing off his PhD, guys, as is Taryn, as most of you have met her. And yeah, these are dramatic people who have actually embarked upon all these honors projects after their degree, after medical science, went on to do their PhD. Taryn's completing medicine at the same time that she's completing her PhD with me. Luke's completing his PhD. So yeah, if you're thinking about honors and future research beyond your undergrad degree, please don't hesitate to contact any of us.
Yeah, we're more than happy to answer questions about it, guys.
Yes, and I hope to contribute during today's tutorial. Thanks for having me, Luke.
Thanks, Sarah. All right, so we're going to get started. This week we're looking at sleep and dreams, which is a really good continuation on what we did last week, which was learning all about EEG. So you should find it pretty smooth sailing from here. So we're going to jump straight into it. So this is like a summary slide where we look at introducing REM, which is a phase of sleep, basically. So sleep is an essential function required for regeneration, growth, development, and learning. And these 4 aspects of sleep are all enhanced by one particular stage of sleep, which is REM sleep. So REM stands for rapid eye movement. It is a phenomenon that you experience where your eyes will move rapidly while your eyelids are closed. And that REM period constitutes about 20 to 25% of total sleep time in adults. So in particular, when it says regeneration, muscle regeneration is really important in REM sleep, and things like learning. So we haven't done memory and learning yet. You'll do that later in the semester. But memory consolidation, which is the conversion of short-term memories into long-term memories, that is really, really important in REM sleep. So if you're not getting enough of your REM sleep, then you're not able to consolidate memories as well. Your muscles won't regenerate as well, or like you won't have proper tissue repair after like a big physical workout and things like that. And in terms of what an electroencephalogram looks like of someone who's sleeping, it is vastly different to their awake stage, but with rapid eye movement, your REM stage of sleep, it is actually very similar to your waking EEG, which is quite interesting. And this is because dreams mainly occur during REM sleep. You may have come across that before. So what's interesting is that people, when they're dreaming, have these like perceptual experiences that they believe are real, but they can be difficult to awaken. And another very important aspect of REM sleep is that you have total atonia, which is where you don't have any tone in your muscles. It's completely absent, which is great. This is so that when you're dreaming, you have perceptions that you believe are real at the time, so visual as well as hearing perceptions, and there will be real motor activity from your brain that would cause you to act out your dreams in real life. So if you were perceiving like a train coming towards you in a dream, if you didn't have this lack of muscle tone, then your body would physically launch itself out of your bed and basically hurt you. So it's a really important sort of adaptation that we have in response to dreaming. But more on dreaming later. So during REM, our eyes flick rapidly. Yep. And the movement is associated with changing scenes in our dreams. So we used to think that it was you would be looking around at things you were seeing in your dreams. And a more modern theory is that when the the movement of your eyes while you're during REM is corresponding with changing scenes. So in the way one might change the channel with your remote on a television. So REM, as I mentioned, is just one of your phases of sleep. So if you slept for 7 to 9 hours of sleep per night, that would involve around 4 to 6 sleep cycles. And each cycle involves 3 stages of non-REM sleep, so which progressively get deeper. And then each sleep stage is then followed by one stage of REM sleep. So you go through 3 stages of non-REM and then 1 stage of REM sleep, and that is a full sleep cycle. And you'll have about 4 to 6 of those per night, and they just sort of keep going throughout the night. So this diagram looks a bit weird. It is a lot of information in one slide. So you'll have to bear with me, but there's lots of things that you can get asked on just from this diagram. So I've tried to condense all of it just into one slide. Okay, so I know this sort of looks like an EEG. It's not meant to be. Each of these bars is just representing how long someone, like this individual, for example, has spent in each of the stages of sleep. So starting from, let me just read out what Sarah said. So REM is an interesting phase of sleep, and you can cycle through multiple sleep stages in a sleep period. Yep, exactly. And just to continue on with that. So this person went to bed around midnight. As you can see, they were awake up until that period. And your awake EEG is mostly comprised of beta and alpha waves. So alpha, mostly predominantly in like a relaxed eyes closed state. So you can imagine this person was falling asleep for like 7 to 8 minutes. So they spent that time with their eyes closed. So they started to see predominantly alpha waves during that period. Remember, alpha is associated with closed eyes. And before that, you might have seen mostly a predominance of beta waves, which is associated with mental activity or any kind of physical work, like moving around the house or whatnot. So this person went to sleep at around midnight, and they fell into stage 1 of non-REM. So stage 1 non-REM is categorized by predominantly theta waves. So these are between 4 and 7 hertz. Then they would spend maybe like 10 to 15 minutes in that before moving into stage 2 non-REM. This is where we start to see sleep spindles, which I've got a diagram that shows you what a sleep spindle looks like on an EEG, but they are associated with, or thought to be important with, memory consolidation. And then in stage 3 is your slow wave sleep, and it looks like really slow wave sleep, really slow, really high amplitude EEG waves. So we have looked at what your delta waves look like last week, and they have a frequency of less than 4 hertz. So these are your 3 stages of non-REM sleep. Sometimes in older diagrams, you'll see stage 3 and stage 4. They'll be separated. More modern diagrams just use stage 3. So it's combining stage 3 and stage 4 into just stage 3, because physiologically they're quite similar, and they're both just like really slow wave sleep. All right, so at the end of that, you then move into REM, which is your indicated by this red bar here. And you can see this first stage of REM sleep doesn't come about for about 90 minutes after you first fall asleep. So it takes a while before you can have your first REM period. It is, as I mentioned, dreams mostly occur during REM. You can have some dreaming occur in non-REM. It's not hugely common. Dreams mainly occur in REM. So if you wanted to study dreams, you would try to study people just in REM sleep. And yeah, so an EEG of someone, if you measured someone during REM, it would resemble their awake state, because they are having perceptions and their brain is almost doing some decision making and some other activity that is related to your awake state. So it makes sense that it resembles that. And then, as you can see, across the course of the night, an individual will continue going through each of these sleep cycles again and again and again. So they go back through stage, you can see in the second one, they've skipped stage 1, which can happen. But for the most part, they will go stage 1, 2, and 3. Interestingly, in the later half of the night, this person is skipping their stage 3 of sleep. Another couple of points. So just drawing your attention to the left here, as sleep deepens, so the longer you are asleep for, your EEG waves become progressively slower, so they decrease in frequency, and they become larger, so they increase in amplitude. And that's just what this sort of area is trying to convey. So you move from beta waves to alpha waves when you close your eyes, and then as you fall into sleep, you go into theta waves, and then you start seeing delta waves, your really slow waves, the deeper you are in sleep. So interestingly, yeah, REM sleep isn't necessarily like really deep sleep. So when people say like they're in such a deep state of sleep that they start dreaming, it's not really true. REM sleep, when dreaming occurs, is actually more like being awake, if anything. Then down the bottom here, I've just mentioned that with each subsequent sleep cycle, so as we're moving from left to right, your REM periods occur more readily and they become longer. And what's interesting is that these brief awakenings that can just naturally happen. So you might just naturally wake up during the middle of the night for a couple of minutes. They don't seem to reset how long it takes for you to get back into REM sleep. So you can see on the right-hand side here, it's getting increasingly easier for this sleeper to cycle back into their REM sleep. So your REM periods start getting much, much longer the longer you are asleep. And that is why just getting 1 extra hour of sleep is really critical. So obviously, you know, if you have to get up at 7 a.m. for work, then you have to get up at 7 a.m. You know, that's when you set your alarm. But going to bed even just an extra hour earlier means that your last hour of sleep is going to be really rich with REM sleep. So if you look at this first 2 hours of sleep, there's like 10 minutes of REM. It's not the best sleep, but if you look at like the last hour, it's going to be like 75% more or more of REM sleep. And that's what we consider your best sleep, your most regenerative sleep.
So I might pipe in at this stage, Luke, and just point out that as sleep progresses, you have longer and longer REM sleep before you just wake up. And as you sleep, you have longer and longer stage 1, 2, 3, and 4 of sleep. So you're in deeper stages of sleep as you're trying to get into sleep when you first start sleeping. But when you're about to wake up, you have more REM. That's when sleep becomes a little bit light. And stage 4 and 3 of sleep will actually shorten. So you have more visual dreams just prior to waking up, whether you're sleeping in the daytime or whether you're sleeping in the nighttime. Most of the dream phases are occurring visually and things that you remember more in just before the waking states as well.
Definitely. So we have a question here. When someone is really exhausted and they go to sleep, would their sleep cycle still look the same as someone who is feeling normal? So if someone who went to bed just as normal versus someone who was exhausted, for the most part, they would be pretty similar. You would have to do something weird like starve someone of their regular REM cycle in order to get their sleep cycles to look different. So for example, if you kept waking up someone when they were trying to enter their REM stage, then the next night or the next couple of nights, their body really craves that REM sleep. So you would see them actually, it wouldn't take them 90 minutes to get back into REM. It might only take them half an hour.
So what Luke is talking about is if you were REM deprived on one day, which means you didn't have enough sleep and you were REM deprived, you would actually try to catch up on your REM the day after when you sleep. You'd have more REM phases. And somebody asked whether what type of sleep you'd have when you're exhausted. When you're exhausted, the general notion is that you will actually strike your deeper stages of sleep sooner when you fall asleep. So your stage 1, stage 2, which are your lighter stages of sleep. Then you've got stage 3 and stage 4, which is your deeper stages of sleep. You'd have more your deeper stages of sleep sooner. So instead of staying awake forever and trying to fall asleep, when you're exhausted, you'd hope that one would fall asleep sooner.
And I imagine stress would also have an impact on that, Sarah?
Yes, stress would certainly have an impact on that. Stress is known to affect your sleep patterns as well as your circadian rhythms, especially if you're stressed from work with shift work, etc. So stress does tend to disrupt sleep as well. Such an exciting area of neuroscience, guys, sleep.
Yeah.
When you start thinking about the different stages and the dream states, I'll just give you an example. There's something called REM state disorder, like Luke mentioned, where you actually can act out your dream. In REM, generally your body is supposed to be paralyzed. So when you're dreaming, you're not supposed to be moving too much. But those who actually have REM state disorder will actually act out their dreams. And if you read some of the textbooks, they talk about partners hitting partners while they're sleeping because it's just a dream they're acting out and they haven't got a clue what they're doing. But people can become quite physical when in REM sleep if they have a REM sleep disorder. Just an interesting fact, guys.
It does come up later actually in the tutorial, but yeah, it'll be good. It is a very interesting topic, guys. So we are definitely expecting lots of questions today, and should be ready for any of them. Do you cover lucid dreaming, how that works in this tutorial? So lucid dreaming is where you're able to know when you're dreaming. Sarah, are you about to chime in with something?
Sorry, I was just sorry, Luke. I was just typing away there.
Oh, sorry.
What was the discussion again?
Oh, lucid dreaming.
Yes, it's not something we actually cover in this tutorial. And I must say, I haven't read a lot about it in the literature or in the scientific literature. Whoever's asking that lovely question, which angle are you coming from? Do you want to add a few more points to that before we respond?
Just if we're going to cover it in this tutorial, because it's another sort of interesting part of sleep.
Of course. And what angle would be of interest? Please do click a few points through.
Yeah. And does this apply to, so does REM disorder apply to sleepwalking? Those are actually two different things, but we will go into sleepwalking in a little bit.
Yes, can I point out, Luke?
Yeah.
This is a very nice question. Does that apply to sleepwalking, REM disorder? Just think for a moment, everyone. Why would sleepwalking not necessarily be an REM disorder, or why would it be an REM disorder? So we said before that REM disorder is when a rare person will actually act out their dream. So they get actually physical in their dreams and they act it out. Generally, in dreams, you're not supposed to be moving. You're supposed to be quite still. So no, sleepwalking is not part of REM or REM disorder. Sleepwalking, if I'm not mistaken, and Luke will correct me, is confined to usually stage 3 and 4 of sleep.
Yep,
when
yep.
in your different stages of sleep, movement can occur and people can either talk or walk in their sleep. Another very interesting question that was.
Yeah. So just following up on the lucid dreaming question, is lucid dreaming during REM sleep or other stages, and how can it come? So what stage of sleep is lucid dreaming? I would say obviously it has to be REM sleep, and I believe it's just the idea of being aware that you're dreaming, and so that you have more control over your dreams. But because you are dreaming, it still feels very real. So that's, yeah, when you're dreaming, you believe that your perceptions are real. So it doesn't matter that you're skeletal, you don't have any control over your body. The fact that you believe it's real, yeah, that's basically your answer. I would also just say that lucid dreaming, I think you have a higher chance of being able to remember your dreams when you wake up, whereas for the most part, it's really hard to remember your dreams. So as you can see in this diagram, a person has 4 to 5 REM periods per night. Dreaming will occur during most of those, or all of them. And generally people won't remember dreams from any of them, except the most recent one. And even then, as you're waking up, you can start forgetting about your dreams immediately. They're just not considered sort of a priority for your brain to remember. But lucid dreaming, I think potentially you would have a higher chance of remembering that because you're more aware. It's almost like a meditation state because you're more aware of the fact that you're dreaming and you have more control over them. Is inception real? Great question. We won't go into that. We're going to keep moving forward, guys. I can see Sarah's answering some of your questions. All right, so this is what a sleep spindle looks like. As you can see, it occurs mainly in stage 2 non-REM, and it's in what it would otherwise be a rather unremarkable stage of sleep. So you have your theta waves, which are starting to get slower, starting to get bigger. And then you have this sleep spindle, which, as I mentioned, is associated with memory consolidation. Will we be covering sleep apnea? A little bit of sleep apnea, I believe. This is a summary of sleep. Just looking over it quickly, we have covered all of this. Yep. Okay, so sleep disorders. So we're going to go through a couple of these. These next couple of slides are just straight from your lab manual. So insomnia is your first sleep disorder that we're going to just talk about. It's your most common one. It basically is just failure to get a required amount of sleep. And that can be vastly different from person to person. So some people actually need like 3 to 4 hours of sleep per night in order for them to not feel like too drowsy the next day, or for them to just be able to go to work and function normally. Some people need 8 hours or more. And the amount of sleep that you need is a really weird question to answer. It just varies person to person. And in fact, why we sleep is something that we still don't know after decades of research. We do not understand why we need to sleep. We just know that it's incredibly important. If you look at it from an evolutionary perspective, just really quickly, so all species of mammals, reptiles, and birds sleep. And one would think that if sleep wasn't incredibly important, then evolution would have provided us with an adaptation by now where we wouldn't have to sleep. But instead, all we have at best is that like some species only have to sleep for a couple of hours, like horses, for example, only have to sleep 3 hours. But yeah, it's a critical function for a wide, massive variety of species. Regarding the hours of sleep differing per individual, does this mean that the constant promotion of get 8 hours or more is not necessarily true? So what's really interesting is that a massive study on 1 million people from both genders looked at the mortality rate of people from different sleep groups. And the group that slept between 6 or 7 hours of sleep per night had the lowest mortality rate. So over the course of this study, they died the less, people who slept for 6 to 7 hours. So that doesn't, and a lot of people interpreted that as meaning, okay, if you sleep 6 to 7 hours per night, then you live longer. Whereas I would say it's probably more accurate to say that if you sleep 6 to 7 hours per night, it's more likely that you're someone who is healthy and fit enough to be working, because 6 to 7 hours per sleep per night is something that is very common amongst workers. People have to get up at 7 a.m., 6 a.m. every morning. Sarah, did you have something to add to that? But in terms of getting 8 hours or more, yeah, there's actually a worryingly high mortality amongst people who get more than 8 hours of sleep per night. Yep. Potentially because they're having to, for example, psychiatric disorders can cause you to have more or less sleep than around that 6 to 8 hour mark.
Yes, so some people will need generally more hours of sleep. They generally sleep more. Some people sleep less. There was a scientific experiment conducted by a college student that I read about, and he tried to stay awake for as long as he could. And he went on for a couple of days. It was something in the order of 3 days, I think. And he was still fine. He did not feel too sick. He was okay. I think he was playing snooker or something on the last day of staying awake. But at the end of the day, when he did go to sleep and when they put on all the electrophysiology to assess his brain activity and eye activity, they found that he was catching up on REM sleep more quickly than he was actually catching up on more his stage 1 to 4 of sleep, which he did later anyway. over the next few days, but he was fine. But I wouldn't suggest such experimentation if you don't really need to do that.
No, it's not the best idea. It's incredibly difficult to go for more than a couple of days without sleep. You will just basically collapse. Another question: is it true that snoozing your alarm causes you to start a new sleep cycle, and then waking up 5 minutes later will disrupt the cycle? Snoozing your alarm, start a new sleep cycle. Yeah, look, anecdotally, I could say that going back to bed immediately after snoozing my alarm, I'm sure there are occasions where I've been able to start dreaming again as soon as I go back to bed after hitting snooze. And that would suggest that it hasn't started a new sleep cycle. I actually don't know too much about that. I would say, though, that in terms of disrupting your sleep cycles, it's very weird. And as I mentioned, those brief awakenings that you have throughout the night don't seem to affect that, how easy it is for you to get back into REM sleep. Sarah, I can't hear you. Are you muted?
Sorry, can you hear me now? Yes.
Yeah, I can hear you.
Depending on how much you've actually woken up from the alarm, if you've sort of come out just lightly and gone back to sleep, it probably doesn't disrupt the sleep too much. But if you're fully awake from the alarm, then you would probably start your cycle again. You would probably start from your stage 1, 2, and go quickly to stage 3 and 4 because you're still in the middle of sleep there somewhere, hopefully. Yeah.
All right. So speaking of insomnia, you've got primary insomnia, which is a specific dysfunction of sleep mechanisms in the brain. So we'll talk about sleep mechanisms and the molecular basis of that in a couple of slides. And secondary insomnia is when your insomnia is secondary to another condition. So psychiatric disorders like depression and anxiety are probably the biggest causes of secondary insomnia. Just because of the way that they can also affect your sleep mechanisms. So then you also have hypersomnia, which is serious but less common than insomnia. Common causes of persistent daytime sleepiness include narcolepsy, sleep apnea, drugs, and depression. So I actually think now that I think about it, actually I don't think we'd go too much into sleep apnea, but in general it is breathing difficulties when you're trying to sleep, like if you have chronic obstructive pulmonary disease, or even just a positioning of how you're sleeping, and it's associated with things like snoring and that. But we don't go too much into it. There's a nice little paragraph on narcolepsy here. We're going to skip straight over it because we bring up narcolepsy later on, and it's got more information that I'm more interested in. This is just talking about like the sort of molecular basis of narcolepsy, but we do come back to that. Oh, okay, here we go. Do sleep apnea. So it occurs in the upper airway at the back of the throat. It reduces oxygen, which momentarily awakens the person. That's really important, is that although even when you're dreaming, you are completely paralyzed, throughout any point that you're sleeping, you have mechanisms to wake yourself up. So it is generally impossible to like roll onto your face and just suffocate during the night. Your body will wake yourself up if it detects low oxygen, because it doesn't want you to die, basically. Human body is very smart like that. Patients with sleep apnea are usually overweight. They're usually unaware of their awakenings, and importantly, it can go undiagnosed for a very long time. So because they're not aware, they might just be waking up during the night and not knowing why, but it was because maybe their tongue had fallen back far enough in their throat that it started to reduce their airflow or something like that. And so it'll just cause them to be drowsy throughout the day, and they'll have no idea why, but it's actually because their breathing's being obstructed during the night. And we've got some treatments here as well for that. All right, so we've got a couple of questions that we're going to go through together. So a behavioral definition for sleep: it is a reversible unconsciousness state, lack of mobility, and increased arousal threshold. So being in a coma or under general anesthesia, neither of these are readily reversible. So they're technically not sleep. They are distinct from that. Question 2, during what part of the night is slow wave sleep seen? So as we talked about, your slow wave sleep is stage 3 and stage 4 non-REM, which we now just kind of refer to as stage 3. So it is mostly prominent during the first third of the night. And I won't go back to that diagram, but you should just be able to remember that your first third of the night is primarily, has really long periods of stage 3 slow wave sleep. And then in the sort of like last third of the night before you wake up, that is really heavily REM sleep. So your first REM period will typically occur about 70 to 90 minutes into your first sleep cycle. And then after that point, it becomes easier to get back into that, and your REM periods become longer. So those are the main takeaways from that. Question 4, what happens to REM periods across the course of the night? They become longer in duration. Question 5, what percentage of total sleep in adults is composed of non-REM? So it's 75 to 80%, and it's the opposite for REM sleep. All right, then we have a question on what happens to your sleep cycles as you age, which is a really interesting question. So you can see on this diagram on the right, we have from birth all the way up to like late elderly, like 85 years old. And each of these blue sort of bars is just representing what is the distribution of sleep relative to each other. So you spend not many hours awake when you're incredibly young. You only spend about 8 hours of each day awake, and you spend a massive amount of time in REM sleep or dreaming, which is quite interesting. It's almost 50-50, honestly, 50% REM, 50% non-REM. Then as you get older, towards your adult life, you see more of a typical spend 8 hours sleeping, and you spend about 2 hours of that in REM sleep. And then as you get into your elderly stages, you spend a lot of time being awake, and you see some really interesting things happening with your sleep schedules as you get older. Your circadian rhythms, which I'll talk about in a minute, are your internal body clocks, and they actually shorten as you get older, and it starts causing these weird sort of lapses in your ability to have REM sleep, as well as just sleep in general. So decline in REM sleep as you get older, spend less time in slow wave sleep, and fragmented sleep patterns, particularly in the elderly. So they'll wake up more frequently during the night, and they might have more trouble getting back to sleep. All right, then we have a question on Zeitgebers. So it's German for time givers, and these are a whole bunch of different things. So in general, though, Zeitgebers are environmental variables that entrain an individual's internal body clocks, or your circadian rhythms. So you might refer to these as your sleep schedule, but it's so much more than that. Your circadian rhythms are a set of rhythms for each individual like level of molecule in your body. So cortisol has a circadian rhythm, thyrotropin has one, melatonin has one. These are all circadian rhythms. So your strongest factor to entrain your circadian rhythms is daylight. So on Earth, we have a rough 24-hour schedule. Half of that is in daylight, half of that is in nighttime, with small differences depending on the season. And then weaker factors that affect your sleep schedule will be things like exercise, social stimuli, temperature, and your feeding times. So this experiment on the right it was conducted on subjects who withheld from sleep, but they were still allowed to go outside, be exposed to daylight, and enjoy their otherwise normal schedules. The gray bar is indicating when they would normally sleep, but obviously during this experiment they were withheld from sleep. So what's interesting is that your circadian rhythms will attempt to persist even in the absence of sleep. So sleep isn't necessary to entraining your circadian rhythm when you have daylight. It is a really strong it is a really strong, it really makes your sleep schedule, your like circadian rhythms quite rigid. And if you try and mess with these, with your internal body clock, it can have really bad, especially really bad long-term consequences. So if, you know, like cops, nurses, truck drivers, who attempt to work like a 12-hour day shift, and then a couple of days later, they'll have to work like a 12-hour night shift, that is incredibly disastrous for their bodies. So you see huge incidence of diabetes and other metabolic disorders, as well as a range of cardiovascular disorders in people who work shift style. And I'm not talking about like supermarket shifts, because those are generally stick to a daytime schedule. I'm talking about like you work like midnight to 6 a.m. and then the next day you work 3 p.m. to 9 p.m. That is very disastrous for your body. And there's a huge body of research that is trying to abolish shift work in general.
Pilots tend to suffer quite a lot.
Yes,
from circadian rhythm disruption as well. So they're there's issues with their circadian rhythm quite a bit.
Definitely. Okay, so then we have microsleeps. So microsleep is a transient sleep, only lasts around 3 to 14 seconds. Humans aren't supposed to have microsleeps. There are some species, for example, there's a species of dolphin in Pakistan that lives in a river, and it sleeps purely with microsleeps. So it sleeps about 7 hours a day, but in 3-second bursts, which is very strange. But human beings not really supposed to have microsleeps, but it can happen. Particularly truck drivers, this is a big scare, and people who drive for extended periods of time, because it's where you move rapidly from a waking state to stage 1 non-REM, particularly if you're just feeling exhausted, and it can be with or without behavioral manifestations.
So what happens during microsleep, guys, is you're actually in a fatigue state generally, and there can be a lot of microsleep if you're really, really tired. And like Luke said, it can be disastrous. Truck drivers and other heavy machinery workers, etc., in mining, etc., pilots, you don't want them to have too many microsleeps while they're actually performing their tasks.
Yeah, certainly not. And you guys might remember this ad from like the 2000s, where we were campaigning against microsleeps because they are so dangerous. And they had this Stop, Revive, Survive campaign, because they wanted drivers to just take a break while you're driving and try to avoid microsleeps. All right, then we have a couple of questions on this idea of REM on and REM off. So what are the brain mechanisms that allow us to turn REM on? So activation of your cholinergic neurons. So these are what release acetylcholine, and they trigger REM sleep to turn on. And then in order to turn REM off, you see activation of noradrenergic and serotonergic cells, which produce noradrenaline and serotonin respectively, and also histamine. So those are your REM off cells. And we'll do a little bit more about those next week when we do your diffuse modulatory systems. So try not to feel too overwhelmed by these new terms. Question 12, where are the suprachiasmatic nuclei located? So they are, you have 2 suprachiasmatic nuclei actually, and they're in the anterior region of the hypothalamus, so just above your optic chiasm, and that is in a really good spot to be receiving information from your retinohypothalamic tract, which leads straight from your hypothalamus to your retina. So if you, for example, you're receiving information that the sun is rising through your retina, that is going straight to your suprachiasmatic nuclei, and they are responsible for modulating your circadian rhythms. Question 13, summarize the neurotransmitters involved in wakefulness and sleep. This is going to look like quite a scary table to you guys because you haven't done diffuse modulatory systems yet. That's going to be next week. So if you revisit this table after next week, all this is going to be familiar. So locus coeruleus, ventral tegmental area, that's all going to be fine. You're not going to be so scared about it. But in general, you have these 5 neurotransmitters involved in wakefulness, and you have these 2 which are involved in non-REM sleep.
I think they had the diffuse modulatory system lecture today.
Oh, you had the lecture. Oh, that's good. That's good, actually. And then we got the tutorial next week. So there'll be a bit of revision for you guys as well. 14, what are some wake promoting factors found in the cerebrospinal fluid? So this is the fluid that nourishes your central nervous system, and it contains a range of like metabolic, I guess, you would describe these. You have some in the cerebrospinal fluid and some in the blood that are both involved in promotion of wakefulness. Epinephrine, cortisol, histamine, again, some of these you would be familiar with from your lecture today, hopefully. If not, we'll cover them next week in my tutorial. And then what are some of those factors that are thought to promote sleep? So in the cerebrospinal fluid, you have enkephalins, which are pain receptor antagonists. So reduction of pain, promoting sleep. Endorphins, dynorphins, growth hormone. So a lot of these are important in muscle regeneration. So if you have had a sort of big session at the gym, and then the next day you're feeling really sore, you should be sure to get a decent amount of sleep. Like I would say probably more than 8 hours if you've had a burst of physical activity that is more than you normally would. And you want to ensure that you get right amounts of tissue growth, tissue repair and muscle regeneration, because there are some aspects of that which are exclusive to REM sleep. So really important there. Question 16, we're going to talk about a couple of sleep disorders. So this did come up before, sleepwalking, which is also known as somnambulism. So this has a peak occurrence in children. I actually believe that I think 40% of all people have sleepwalked at some point in their life, which is quite a big statistic. It occurs during stage 3 non-REM. I actually think Sarah mentioned this at the start of the presentation.
Yep.
But what's interesting is that you're not dreaming when you're sleepwalking. If you're dreaming, you're in REM, and it means that you are completely paralyzed. Can't be walking around. With the exception of REM, state behavior disorder, which is quite rare. Sleepwalking is incredibly common, and it tends to be people walking around and just carrying out like normal daily activities. So they might make breakfast or go take the garbage out, and they have their eyes open and have an awareness to avoid objects, but they're not conscious. They're not going to have a recollection of this when they wake up in the morning. And then you have sleep talking, which is also known as somniloquy. Nonsensical and garbled talking. If your partner is next to you at night and you're listening to them sleep talk, chances are they're not going to say anything interesting. It's just going to be completely nonsensical. Then narcolepsy. So this is what I wanted to talk about. It's just a bit more informative in terms of the condition. So it is a chronic condition, and it is comprised of these sleep attacks. So it is a stage of REM sleep abnormally intruding into your just normal daytime wakefulness. So there's no cure for it. Treatment is trying to target symptoms. And in people with narcolepsy, you can have sleep paralysis. It's quite common in people with narcolepsy. So it's where sleep paralysis is where you're entering sleep or where you're just waking up. And it's where you have full body paralysis. So you have the REM symptom of muscle atonia, but you are conscious. And that's very scary for someone because you have an awareness that you're awake, but your body is completely rigid and you can't move whatsoever.
So I should just pipe in again. It's an interesting state, everyone. Like I said, in REM, generally there's a paralysis state. So when you are in a narcolepsy state, you have actually sleep paralysis. That's why it's linked to the REM-like disorder. And it's really interesting. You'd find people would be walking and then suddenly they're falling down. So it can be dangerous as well, but they go straight into a sleep state. It's like Luke mentioned, there's just no cure for this at the moment. Luke, I might give you a bit of a break when you get to the dreams section and I might continue for you.
Okay, sure. That'd be great. Cataplexy can also be present. It's where, sudden muscle paralysis while conscious, and it can often be triggered by intense emotion or laughter. So it's something that they have to be aware of when they get diagnosed with this. And narcolepsy can present a huge problem to people while they're driving, for example. You really don't want to have one of your sleep attacks, and as well if you're swimming. So some big lifestyle changes that might need to be considered for people with narcolepsy. We have a question: why do so many people report such horrific images when they're experiencing sleep paralysis? Is it because they're sleep deprived? Yeah, I would say that's part of it. And also because you are just waking up from a sleep state, you may even have some of those perceptions that you are having as you're waking up. I also think there's the general anxiety associated with waking up and you're completely paralyzed is an experience that can't be had on a day-to-day basis. It is something that you will never experience outside of that sleep paralysis. And the amount of anxiety that comes with that may cause you to have or like hallucinate, you know, seeing like a monster across the room from you or something like that. But it is very common for people with sleep paralysis to report seeing or experiencing like a sudden surge of fear. But yeah, okay, so we have a couple of questions on polysomnograms. These are a range of electrophysiology techniques applied to someone in order to study their sleep. And it is a diagnostic tool for sleep disorders. So they'll keep you in a sleep lab for like 12 hours. It consists of an EEG, EOG, which is measuring eye activity, EMG is muscle, and ECG is heart rate. What sleep disorders require PSG for diagnosis? It's mostly like sleep apnea and breathing disorders, but it may also be used for REM behavioral disorders. What are the indicators for PSG in patients with insomnia? So it's when symptoms of insomnia are not adequately diagnosed by obtaining a sleep history. So sleep history is like having a sleep diary. And when is it indicated in patients with parasomnia? So parasomnia is usually when it is thought to be seizure-related, violent, or atypical otherwise. And it's also indicated when other diagnosis options won't work. So it's kind of like a last resort in that aspect if you've got a really complicated case. We're up to dreaming now. So Sarah, maybe you want to take over from here.
Yes, I might just go through, if you might just flick through the slides for me there, Luke.
Yep. So
yes.
Dreaming right now? Yeah.
Yep. So define dreaming. Well, it is a perceptual experience. A lot of us can remember our dreams, like Luke mentioned. Just before waking up are the dreams that we mainly remember, not the dreams that we have when we first fall asleep and our REM starts to kick in. Don't forget, REM state actually gets longer and longer as we sleep more and more into the early hours of waking. And it is an important area, they say, for unlearning of unnecessary information and for releasing of pent-up emotion or anxieties. That's still a theory, and research in the sleep labs are quite prominent in the area of REM sleep because they're still trying to understand REM quite a bit, and not all is known. So there you are, another area of research for honors projects if people are interested in a sleep lab. Okay, so since dreaming takes place during sleep, how can it be studied objectively? Most of the time it is difficult because dreams are subjective experiences by nature. However, most people will remember their dreams, so you can actually give them questionnaires after they wake up and you can identify what types of dream they had and so forth. Studies have also done it when they go into REM, and if you've got the electrooculogram, electrodes attached onto the eye, when you start having REM sleep, you have rapid eye movement. So people will wake them up during a study and ask them, oh, you were in a dream state, what type of dreams were you having? And their experiences are then noted. We can also measure when REM occurs, like I said, using these electroencephalography or electromyogram, which is EMG, or electrooculogram, because there's changes in eye activity, brain patterns, as well as rapid saccadic eye movement during dreams. When we say EEG, beta waves, what we mean is during REM, you have a lot of fast wave brain activity. Fast wave brain activity is generally linked to beta. Your slow wave brain activity is generally linked to theta and delta. You have more theta and delta during your deep sleep states. But when it comes to REM, you have more beta activity. Now, beta activity is like being in an active state. That's why a lot of people will go into dream states. And if they have more dreams, they will come out saying, oh, that was a horrific night of sleep, or it wasn't a very relaxful night of sleep, and it was quite tiring. Because you have more beta waves, your brain is quite active. Next slide, Luke. So is a sleepwalker acting out his or her dreams? Like we said, even though it appears like a REM state disorder, no, they're not actually acting out their dreams. Sleepwalking actually occurs during a sleep stage, and it is stage 3 mainly, before dreaming actually takes place. So we usually don't dream in our non-REM stages. And our non-REM stages are stages 1, 2, 3, and 4. And then we get into REM generally. That's the cycle we usually have before we get to REM stage. So no, sleepwalking will generally not occur in your REM state. So you are not actually dreaming when you're sleepwalking or sleep talking for that matter. So do brain imaging studies help the understanding of dreaming? Certainly it does. There's PET that is used, there's MRI that has been used. I've been involved in studies myself in the sleep lab in the past, where we've actually used electroencephalography and the full polysomnogram that Luke actually mentioned. And by attaching these electrodes, and while a person is sleeping, we're actually able to understand what stage of sleep they're in, whether they're in stage 1, 2, 3, or 4, whether they're dreaming, and disrupting different sleep stages to see what happens the next day. So if I disrupt your sleeping stage 4 all throughout the night by waking you up every time you're in stage 4, will you have more stage 4 the next day? Or if I don't allow you to have REM sleep at all by waking you up because you're in REM now and I can see it on my electroencephalography or electrooculogram, then will you have more REM sleep the day after? It's a very interesting area. So brain imaging studies do help understand dreaming, but of course it is still limited because dreams cannot be objectively quantified. It's very, very subjective. Next, Luke. So discuss your understanding of a nightmare. Nightmares are complex dreams. So basically they occur during REM sleep. We all say, oh, that was such a horrific dream, or it was scary. That generally occurs during REM sleep. Like we said, all dreaming occurs generally in your REM sleep. And affected individuals can be of any age and generally remember the nightmare. They increase in frequency during stressful periods and are a landmark for the symptom of PTSD. It's true. When you start having a lot of dreams, scary dreams, similar dreams, etc., it has been linked in the literature to PTSD and some other types of mental disorders such as stress, anxiety, depression, etc. But there's various treatments, including counseling and CBT and many others like yoga, relaxation, and so forth. Now, night terror, I don't know whether any of you have ever experienced any such thing as a night terror. It's not a very pleasant state to be in. Generally occurs in children, and it is not a nightmare because nightmares, like I mentioned, are bad dreams and they occur during REM. But night terrors, lo and behold, actually occur during your stage 3 of sleep, which is a non-REM sleep stage. And night terrors will generally leave a child or a person who's having a night terror screaming, distressed, and it's very hard to console them. And parents in this situation get quite distressed together with the child if there is such a situation. But generally just tell them to go to sleep again, calm them down a bit. They will generally have no recollection the next day of what happened in the night. So it's the people who experience it with them who are more affected than generally the people who actually have the night terror. I don't know whether anybody is able to comment on chat room if there have been any experiences with night terrors or narcolepsy, etc. These are interesting conversations to have.
So we're up to the multiple choice questions now. There's only about 10 of them, but they are all revision from this these slides. So I think because it's past 4 now, that I might just leave these for revision actually. It's only 10 questions. They're really straightforward. If you went and did them now, for example, you should be getting 10 out of 10. So I think we will leave it there. Sarah, if you're happy with that.
Yep, that's fine, Luke. Thank you, everyone. And thank you, Luke. I hope this was enjoyable.
Yes.
We're trying to do this as 2 people, both in the lectures and tutorials, as most other academics are trying to now do that. The reason being is someone can manage the chat room while another person is talking. And it's a lot of talking as well for the person who's trying to deliver the tutorial or the lecture. So it gives them a little bit of a break. And I hope it's been useful, everyone. Thank you.
Thanks for coming, guys. Next week, we will be going through diffuse modulatory systems. So it's going to be a big week. Enjoy your weekend, guys. Enjoy the rest of your day. It's been fantastic. Thanks, guys. Thank you, guys. Thanks, Sarah.
Thank you, Luke, and thank you all.
See you guys next week. Bye.
Bye.